Thank you to all of you for the incredible work you do day in and day out to make a difference in our community. Congratulations to the nominees and award recipients of the Bhayana Family Foundation and the United Way Agency Awards for your talent, leadership, and commitment to our great city. The nonprofit sector has clearly demonstrated a remarkable ability to pivot during the COVID-19 pandemic to ensure people who are in need are cared for, whether it's those experiencing homelessness, domestic violence or abuse, or those who are at risk or isolated. So thank you for all that you do.
Hello, everyone. I'm so sorry I can't join you for this award ceremony, but I wanted to say congratulations to all of you for the incredible work you do every single day. I'd like to commend the nominees and award recipients of the Bhayana Award and the Agency Awards for their talent, leadership, and deep commitment to our community in Calgary. The nonprofit sector has clearly demonstrated a remarkable ability to adapt during these strange times to ensure people who are in need, be they unhoused, abused, isolated, or at risk, are cared for. I want to thank you for all that you do.
Hello, it's Naheed Nenshi, Mayor of Calgary here, and I just want to welcome everyone to the Bhayana and United Way Appreciation Awards. In such a difficult year for so many of us, in a year of loss and mourning and grief and uncertainty, it's our nonprofit organizations and our frontline workers who've gotten us through. And so, what a great opportunity for all of us to come together and to celebrate the extraordinary contributions of these organizations and of these people. You know, even in such a tough year, I try to continue to live in gratitude. And I am very grateful today that I get to live in a community with all of you in it. So thank you to our friends at the United Way. Thank you to the volunteers, to the donors. Thank you to the Bhayana family for underwriting these awards. But mostly, thank you to all of those who've been nominated and to all of those that we're honoring today. Thank you for keeping us safe. Thank you for continuing to provide essential services every single day. Thank you for getting us through all of this. Congratulations, everyone.
Thank you, Mayor Nenshi, for your opening remarks. Hello and welcome to the 2020 Bhayana and United Way Agency Appreciation Awards. My name is Susan Brooke. I'm the VP of Community Impact and Partnerships at United Way, and I really wanted to thank you for joining us today to celebrate the dedication and commitment of the individuals and organizations that have worked so effortlessly, selflessly over the past year to help those in need, our family, friends, neighbors, and community members. As Mayor Nenshi said, this has been a very challenging year. And it is very exciting to us as United Way of Calgary and area to bring everyone together for this morning of celebration. Today, in addition to recognizing those local heroes, we will hear from Raksha Bhayana of the Bhayana Family Foundation, whose generosity makes these awards possible. We are also very excited to have President and CEO of Alberta Health Services, Dr. Verna Yu, here to join us for a keynote address, as well as the Minister of Community and Social Services, Rajan Sani, to offer some remarks. We are also honored to have Elder Reg Croshu here to offer a blessing and land acknowledgement before we begin. Elder Reg.
Okay. 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 Good morning. I'd just like to welcome all of you this morning. And I want to acknowledge Creator this morning for all the blessings that He gifts us every day. I just want to also acknowledge Apomachka, Mayor Nenshi this morning, and all the other guest speakers. I'm gonna, we're a verbal society, and we have our oral practices. So we light our smudge to start our events, our meetings, our gatherings. So I'll light the smudge to acknowledge Creator. And Creator gave us the sweetgrass as a representation of sanctified kindness to all. So I'll start with my smudge this morning and acknowledge Creator. Oh, kahe, ayos chipata piyo. Ayos bumukinana pishkanoto ni. Ayo sa Tokyo. Ayo gidans kachimata Christikuya kamstiki no chimakakyawa. Nakachimo iskanis chipata piyo. Ayos bumusawan Christikuya kanikayakshi. But I actually needs to talk piawa because bumusawas chipata piyo. Hagoxis katumoyanik ni dama kamutan yaksipata piyo. Sid ogni dami Christikuya. Hayo Sadokis Bumusam Strictly Dokboka Potaki. Oh, get Christikui Kamutan is the watchman. Yanai. Thank you very much.
Good morning, everyone. Thank you so much for being with us here this morning. It's such a great way to start the day, isn't it? With the Bhayana Appreciation Awards. Thank you, Reg, and thank you, Rose, for being here today and for the blessing and the land acknowledgement. You have guided us so much as our elders at United Way as we learn to work from going to our old camp to our new camp, and really embracing the concepts of sanctified kindness. So we're so honored for your teachings and for helping us work in parallel ways. Thank you. I also want to acknowledge Mayor Nenshi for his warm welcome and his remarks in the video this morning. His courage, his boldness, his passion for the city and its people, and his strong voice in support of community service and volunteers has really helped build a strong Calgary for everyone. I also want to thank the Honorable Rebecca Schultz, the Minister of Children's Services for Alberta, and the MLA for Calgary Shaw for her introductory remarks, and also Ward 7 Councillor Drew Farrell for her kind support in the pre-event video reel. I'm also so excited that so many elected officials are joining us today for this very important community event, as we all know that it's been a tough go. I'd like to welcome Stephanie Kusi, Member of Parliament for Calgary-Mindapore, and Greg McLean, Member of Parliament for Calgary Centre. I also want to honor and welcome Minister Rajan Sawhney, Community and Social Services for Alberta, and MLA for Calgary Northeast. We're so thrilled that you can participate in this celebration today. You'll be hearing from Minister Sawhney later in the program. But first, I'd like to start off by thanking Minister Sawhney for her tremendous support, in particular that you've provided in your ministry to the social service sector during the pandemic and now into recovery to help the most vulnerable. We're so grateful for your foresight, passion for helping people through some of the most challenging times in their lives. I'd also like to welcome Matt Jones, MLA for Calgary Southeast, Jeremy Nixon, MLA for Calgary Klein, who's been a big supporter of United Way over the years, and Tanya Furr, MLA for Calgary Pagan, and of course, Richard Godfrey, MLA for Calgary Fish Creek, and thank you for those warm comments in the chat. We also have with us this morning Yodi Gondek, City Councillor for Ward 3, and Jeremy Farkas, City Councillor for Ward 11. I also want to give a warm welcome to Dr. Verna Yu, CEO of Alberta Health Services. She's going to be speaking later in the program. And I just want to thank you for making time to be with us today to make some remarks for how hard the sector has been working. Thank you. These awards are really a special time to recognize the people in our city that support others. Especially during the last year, the often invisible champions have become more visible because of everything you have braved in your workdays. The people and organizations being recognized today have made sure that the many Calgarians struggling through the pandemic have not been forgotten. In so many cases, putting your own health and safety on the line to continue to provide essential services, programs, and support. In my mind, you are all local heroes. It's one of the things that I'm most proud of working at United Way, the network of caring people that we are privileged to be a part of. By focusing on the needs of the day with an eye to the future, the people and organizations here today helped a community weather the storm that few saw coming. Thank you. When the local state of emergency was called back in March last year, we stood up the COVID-19 Community Response Fund in 72 hours. United Way created a stewardship table that was a collaborative way to get funding into the hands of many here today. It was a true collaboration between the City of Calgary, Alberta Health Services, Calgary Health Trust, the Calgary Homeless Foundation, and the Calgary Foundation. It was an alliance during such a challenging time. By working together, we helped make sure the greatest impact for the most people, helping to address basic needs like food, shelter, and mental health support. Hundreds of local agencies received more than $13.1 million for these critical services. It's been an inspiring and hope-filled response that I think demonstrates how much Calgary values the social agencies working to help others. It's the one thing that I really love about living here. People don't turn the other way. They stand with you to lend a helping hand to someone in need. Now, as we move into recovery and rebuilding, I feel hopeful about what we can do as a community together. We've seen the power of standing shoulder to shoulder through a crisis. many times in this city, and I know that we can't do it alone. So thank you to the agencies, the passionate people, the organizations that can see the path forward and investing time and energy into building a more resilient Calgary, that are working alongside us as true partners. We appreciate you. We thank you. And I'm so excited to honor you today. Right now, I'd like to bring to the virtual stage a longtime supporter of United Ways, CEO and co-founder of the Bhayana Family Foundation, Raksha Bhayana.
Thank you, Karen, and good morning all. Welcome to the United Way Calgary Bhayana Family Foundation Award Ceremony. Is my video not on?
It's not on, Raksha.
Okay, hang on a second. I thought it was on. Okay,
There you go.
my apologies. Good morning again. Welcome to the United Way Calgary Bhayana Family Foundation Award Ceremony. Thank you to our esteemed guests, Honorable Minister Rajan Soni, Dr. Verna Yu, Elder Reg Croshu, and MC Wakefield Brewster for being with us today. We are fortunate that MP Greg McLean, MP Stephanie Kuzi, MLA Tanya Furr, MLA Jeremy Dixon, MLA Matt Jones, MLA Richard Gottfried, Councillors Jeremy Farkas, George Chahal, and Jyoti Gondek have joined us. Your presence makes a real difference. I would like to start with a question. How many Albertans do you think work in the nonprofit sector? Some of you know this, but it bears repeating. 200,000 Albertans. And what is, second question, this will be the last question, what is the nonprofit sector's contribution to the province's economy? $9.6 billion annually. The social impact is immeasurable, value beyond money. The external world is at times oblivious to the work being done in the sector. The nonprofit sector and its dedicated professionals are at times overlooked and undervalued, invisible. Recognition is important. I want to offer my heartfelt congratulations to the nominees and winners of the Bhayana Foundation Invisible Champions Award and Agency Appreciation Awards. You have been recognized by the toughest jury in the world, your peers. You are driven by the best parts of the soul and a passion for social impact. You transform lives. I want to share a quote with you from the Calgary Social Voice that says it a lot better than I can. No one has their finger on the pulse of the community like human service agencies and their staff. They operate on the front lines of society with a deep and immediate understanding of the community's needs. They do their work quietly, out of the limelight. They do it because they care and possess the talent, creativity, and enthusiasm to make change. Today, you will hear stories of incredible innovation, dynamic leadership, endless compassion, and inspiring dedication. As poets like Wakefield Brewster know, stories, poetry, and metaphor are non-linear and have a way to change our hearts and minds. The beginning of the pandemic, as Karen said, was a frightening time for us all, but especially so for people who are vulnerable. Who would be there for them in the stark isolation of their homes or the streets? Where could they go for food, for shelter, and comfort? You were there for them. The stories of how the nonprofit sector adapted, led by the United Way, and continue to adapt to this challenge are remarkable. They include providing help to abused women and children. As you know, the numbers have gone up dramatically during the pandemic, to the homeless, to families distressed by mental illness and addiction, to seniors hungry and isolated, to people who are disabled, trapped by lockdowns, to anyone suddenly unsure how to find basic needs like food, housing, and a sense of security. You, the invisible champions, were and you continue to be there. You pivoted to your new responsibilities within days and you continue. This is why shedding light on your positive impact is so important. How do you help? You listen, learn, focus on what people need and work with them to make changes. Being there, guiding, informing, catalyzing. The verbs are just too numerous to catalog. Here is what you do not do. You do not judge and criticize. You do not impose your solutions, but you seek and co-create them with the people. Your emphasis is always on people's strengths, not their problems. You focus not on fostering dependency, but galvanizing latent capabilities. Why? To encourage your clients to become the productive people they want to be. This is how the nonprofit sector contributes not just to Alberta's economy, but to the lives of Albertans. I have been there. My first job was as a therapist at a children's mental health clinic. There I experienced an incessant demand on my mind, heart, and soul from the families with their complex problems. Like you, I was working in the trenches of a challenging job. What drove me to continue? Like you, a deep sense of mission. When I changed careers and went to the private sector, I was astounded. There was literally no industry that did not award its own. This cemented my resolve to create a foundation with a focus on nonprofit recognition. As we map our post-COVID world, we need to evaluate the many innovations that the pandemic engendered from a systemic perspective. And at the same time, we need to grow the impact measurement capabilities of the sector. Canadian studies have demonstrated a social return of investment of over $500,000 for each youth who completes high school. And perhaps in a post-COVID world, we as a nation, and more importantly, as human beings, will begin to value those who help people at least as much as those who sell products and services. In closing, I would like to thank United Way Calgary, our partners, for a flawless organization of the nominations and selection process and this virtual event. Thank you, Karen Young, Susan Brook, and Paige Ross, and the adjudication committee, and all of the teams that have helped. We are proud to work with you. It is great to be back in Calgary and with all of you. We hope to continue to celebrate you, the invisible champions, by advocating with provincial partners for the creation of an Alberta Day of recognition for the nonprofit sector. Thank you and congratulations to all.
Thank you, Rasha. My name is Wakefield Brewster, professional poet and spoken word artist here in Calgary, Alberta. I'm also a registered massage therapist, and I'm elated, flattered, grateful, and honored to be part of these proceedings today, the United Way Agency Appreciation Awards. I'd like to thank you again, Raksha, and I'd like to move on to our next introduction. It is now my pleasure to introduce another great leader who has shown her dedication and commitment to the health and well-being of our people across this province, especially over the past year amidst the COVID-19 pandemic. Dr. Verna Yu is an accomplished leader in the academic and healthcare sectors and has been involved in public sector governance for over 2 decades. She is currently President and CEO of Alberta Health Services, Canada's first and largest province-wide health system, providing integrated healthcare for more than 4.3 million Albertans. AHS has been recognized as a national and international leader in many clinical and administrative areas, including being named as one of the top 5 most integrated healthcare systems out of 40 countries, having one of the top 3 best health supply chain management systems in the world, and awarded one of Canada's top 100 employers for 4 consecutive years. Dr. Yu is guided by the principle that healthcare is a people business, built upon strong collaborative relationships. In her role as president and CEO of AHS, Dr. Yu has worked hard toward establishing a patient-focused healthcare system that is accessible and sustainable for all Albertans. Dr. Yu, thank you so much for being with us here today.
Good morning, everyone. Thanks so much, Wakefield. Welcome to everyone. Thank you to the Bhayana Family Foundation and the United Way Appreciation Awards for this honor of being a keynote speaker. And thank you to Elder Crowshoe for the morning prayers. In the spirit of promoting reconciliation and gratitude, and in keeping with the calls to action from the Truth and Reconciliation Commission, I'd like to take this opportunity to acknowledge that the work of Alberta Health Services takes place on historical and contemporary Indigenous lands, including the territories of Treaty 6, 7, and 8, and the homeland of the Métis. I'd also like to acknowledge the 46 First Nations communities within which we call Alberta, as well as the Métis and Inuit peoples who form an important part of our healthcare system. We are grateful to those who have come before us and mindful of those who will follow us as we steward and protect these lands. So again, thank you for the opportunity and to celebrate some of the positives that have risen over the last 14 relentless months. And to say that the past year has been extraordinary kind of feels like an understatement, I would say, for all of us. I really do understand how each of you must feel. And those of you who are gathered here today have made the commitment to support those who are the most vulnerable members of our society. And we know this is no small feat. And when you layer on something like a global pandemic, the challenges that you face are exponential. So please allow me first to begin this morning from a place of gratitude. Throughout the course of COVID-19, Albertans have grown accustomed to hearing from Alberta Health Services and Alberta Health. And through that media coverage, we've become the face of the pandemic. But we know that we are not in these trenches alone. The relationship between AHS and the United Way serves as a valuable reminder of all the people in this province who are working tirelessly across the social determinants of health to improving outcomes for all Albertans. And in a time when our health resources are stretched and every admission to an acute site has the possibility for far-reaching impact, we know how hard you have all worked this past year to support us. And for that, we are so thankful. From the first day of the pandemic, we have known that defeating COVID-19 would require group effort. This is not a battle in which a single hero slays the dragon and brings forth a happy ending. And instead, this is really truly a time where we've had to call on every citizen in the world to rally together while asking everyone to maintain their distance. And it's interesting to think of the images and stories that will file away in our memories, family albums that will have gaps where annual photos of special events and family portraits usually live. And we'll each carry a memory of a sadness for the moments missed with the people we love. And yet there are lots of other images that will also last. Because when we're faced with a common enemy in the form of COVID, we found the strength that lies in connection. Neighbors who've hung signs of support on the fences outside of long-term care centers, and people hosted Hearts for Healthcare in their windows. Communities recognizing the pandemic's impact on food scarcity issues developed brown bag programs and neighborhood pantries and refrigerators, and people throughout the province rallied with an outpouring of creativity and support to find safe ways to keep afloat the local businesses they love. While some of these ideas may have begun with a single person, I think that each of those people would tell you their success came through partnership. And when I look at the many things that AHS has been able to achieve this past year, I also know it's in a large part because of our partners. And we continue to be thankful for the support and the work that each of you do in your communities. When the United Way invited me to speak today, they asked if I could speak about what it was like to lead through a pandemic. So let me say at the beginning that it's been like a roller coaster ride. It's been relentless. There have been months of exhilaration where we've had to adapt and evolve at a second's notice, and I've watched our incredible workforce respond with innovation and nimbleness. And there have been moments of absolute exhaustion, which I'm sure many of you are feeling, where there's just not simply enough hours for everything that needs to be done. And yet there's always that comforting consistency where people who continue to show up day after day, sometimes risking their own health and safety to care for people who need our help. And when you have an entire network of staff, physicians, volunteers, and community partners who are pulling together, you really can't help but feel inspired. Over my career, I've learned some very important lessons. And there are a couple of things I just want to really share with you that have really crystallized through COVID. First of all, regardless of the work that anyone does, you have to build trust. And at AHS, trust has always been critical to our success. In fact, it's embedded in our organization's values. Through compassion, accountability, respect, excellence, and safety, it is our goal to improve the health experience and outcome for the people of Alberta. And we know that if we hold true to those 5 values, people's experiences will continue to build and expand the trust that they feel for us. But we also know how easily trust can be lost. And COVID has made things even more challenging. From the onset, our goal is to build trust through keeping people aware, making them safe. And as fast as this pandemic has moved and changed, we've had to stay on top of our information sharing, ensuring Albertans could always access the latest health information they needed. We have to make sure people are able to get their questions answered and that they have confidence in the quality of the information they're receiving. This is a giant effort on a daily basis, but it becomes extra challenging when you're dealing with the sheer volume generated by our current circumstances. Because in this pandemic, every single person is impacted and everyone has questions. And in moments of reflection, I'm especially proud of the work that we've done to respond to the needs of Albertans through the COVID. So for example, we're the first health jurisdiction in Canada to introduce an online assessment tool for testing. This platform helped streamline the process, playing a large role in helping us conduct more than 4 million COVID tests since March of 2020. And it's worth noting that more than 1 million of those tests were completed at South Health Campus in Calgary, because not only is the volume of completed tests a huge accomplishment, but this lab volume, this lab capacity actually didn't even exist before COVID. And through partnership with our wholly owned subsidiary, Alberta Precision Labs, partnership with government, private sector, and philanthropic partners, we're able to set up this lab and provide an ever-growing number of people with expedient testing and results. One of our other successful tools has been HealthLink or 811. This number allows Albertans to speak with registered nurses over the phone. And from the time the pandemic was declared in 2020 until March 31st of this year, HealthLink has received more than 3.1 million calls. That's an average of more than 7,800 calls per day. And sometimes we reach as high as over 24,000 calls, like March 15th of this year. HealthLink has played a significant role in helping people navigate health concerns in a pandemic while helping limit unnecessary visits to our sites. And I think most people will agree that one of COVID's biggest challenges is the loss of control that everyone is feeling. So it's our hope that people trust us enough to help them regain some autonomy in their lives by providing timely testing and results, access to current data-based information. And we really encourage Albertans to see an opportunity to better understand the decisions behind public health directives, and by acknowledging the speed at which some things have changed. We want people to understand that we recognize their frustration over goalposts that seem to be moving all the time. And it's never been as critical as it is now for Albertans to feel confidence in the information and services that we provide to them. Which leads me to the second important from the past year. A big piece of building trust comes from meeting people where they are. And this can be really challenging, especially when you work leading the regional health authority, because the word authority alone kind of conjures up all kinds of preconceived ideas about the footing of a relationship. At AHS, our vision is healthy Albertans, healthy communities together. And the key to being successful in our vision truly rests in that last word, is together. speaks to partnership, it speaks to collaboration, but in a province with 4.3 million people, there are likely 4.3 million interpretations of what the word together means. And so we undertake this work every day through building relationships with people and trying to gain an understanding for everyone's own unique situation. And when I talk about meeting people where they are, one of our earliest lessons in COVID taught us to literally meet people where they were. Suddenly, we're moving to a more virtual world. Physicians are meeting with patients through online platforms. Patients were visiting with families over iPads. And in a time where people wanted to hear from AHS more than ever, we're meeting face-to-face through computer screens. But very quickly, we began to recognize the very inequities that impact many of your clients. Not everyone has access to a device. And even if they have a device, not everyone has the skill set or the comfort level to interact virtually. One of the key pieces of our mission is that we provide patient-focused quality care that's accessible. And with the onset of COVID, it further highlighted some of the real barriers many people in our communities face when trying to access healthcare. And this is where all of you, our partner agencies, have provided immense support. And because all of this, it goes deeper than just being able to communicate with Albertans during the pandemic, because we have to ensure that people actually understand the health risks and implications of COVID-19. And we have to understand how public health restrictions affect people. And more importantly, we need to understand people's response to things like restrictions and vaccines. And in my mind, that's where we really need to meet people where they are. For example, let's look at self-isolation. I'm very fortunate to be in a situation where I can work from home, and self-isolation is very manageable. But for many people in our province, this isn't their reality. We have seen people who should be isolating or people who with obvious COVID symptoms who continue to go to work. We've also seen situations where people's addictions have impeded their ability to stay in isolation. And when these stories get told, they create anger and frustration for others who are adhering to the restrictions. But in the midst of all of this, there has to be room for compassion and understanding. There needs to be recognition that someone who's sick and still goes to work may not be behaving out of malice, but actually out of fear of losing their job, or not making rent, or not being able to feed their family. We also have to consider people's past experiences with healthcare and understand that many people have histories that contain adverse outcomes and trauma. This is especially relevant when we're looking at issues around vaccine hesitancy. We need to better understand what occurs in a person's life that may have resulted in being nervous about vaccinations. We also recognize that some people experience actual barriers when it comes to getting to a vaccine clinic. And sometimes low uptake in parts of our province have less to do with hesitancy than physically being able to attend. And now that we've been living with COVID for more than a year, people are tired. We hear about COVID fatigue all the time. A couple of weeks ago, the New York Times gave a name to what people are feeling at this point, and they call it languishing. Basically, after last year's overwhelming sense of fear and dread, the emotional toll of this pandemic has left many people feeling aimless and joyless. And we're starting to see some of that bubble up as people question restrictions or push back on decisions. Unfortunately, it can really allow an us versus them mindset. And that's where we need to remind ourselves that this fight is against one common enemy, and that is the virus itself. So we must continue to remember that everyone has the same end goal, which is to come out of this pandemic with as much of ourselves intact as possible. And COVID actually provides AHS with a huge growth opportunity. It's a chance for us to determine where healthcare has created negative impacts in the past or where we fall short in supporting Albertans. And these barriers to accessibility can have devastating outcomes, and sometimes we aren't even aware that they exist or to what extent they impact. But you all do in the nonprofit sector. And it will be a real loss if we don't actually take away some learnings from the pandemic and especially continue to build our healthcare system for the future. It's a giant piece of work for our organization to tackle. It involves the way that we develop programs, the way that we plan our system. It requires shifts in the way that we think, how we approach our conversations. And we need your help as we evolve our system. And we need to bring all Albertans along on this journey so that they're better equipped to understand how each person's life impacts how they view health. And as I've said, a lot of work is already underway with each of you today. So as we move forward, the importance of these partnerships will only grow. And we know that we will need to keep working to earn people's trust while building a system that's responsive to people as individuals and we will continue to create a great future for Alberta. Again, thank you to the Banyan Family Foundation and the United Way for this honor. Congratulations to all of you. Thank you to all that you do in your care and compassion in making a positive difference to Albertans. I look forward to our continued partnerships. Please stay well, stay safe, enjoy today's celebrations, and please go and get vaccinated. Thank you so much. And I'll pass it back to you, Wakefield.
Thank you so much, Dr. Yu. It is inspiring to know that we have such a strong leader at the helm doing this critical work in our community, especially at this time. This past year, so many people across our city have undertaken critical work to ensure that others have made it through. Many of you with us today have been instrumental in helping our community members through this year like no other. And now we would like to thank you for your hard work as we move into the awards portion of this event. And Karen, I'll turn it over to you to present our first award.
Great. Thank you, Wakefield. I'm really excited to get on with the show and give some recognition. And I just want to thank Dr. Verna Yu for her remarks. And I just want you to know that the not-for-profit sector believes that we are all in it together, and we are seeing the silver linings around partnership, collaboration and innovation, and leading into some of this digital disruption. So count on us to be your partner as we go forward. And thank you again for being here today. So are you ready to get on with the awards? I'd like to present the first agency award today. And we are going to start off with the Agency Social Innovation Award. And this is an award that recognizes an initiative or agency that has implemented a social innovation idea, which led to a community or organizational change. Social innovation focuses on novel ideas that work to resolve social problems for the benefit of society and not for individuals alone. Initiatives or agencies nominated in this category have used innovation processes to generate a novel product or solution, developed a clear, innovative product, described how the product is being used to address community, organization, or systems change, demonstrates results and ultimate value of the innovation in relation to the community, organizational, or systems change. The nominees in this category are the Indigenous Savings Circle by Bow Valley College, the Free Goods Referral Program by the Drop-In Center, Gateway by Immigrant Services Calgary, and Merging for Good by Trellis. All fantastic nominees, and congratulations to you all. The 2020 recipient is dun, 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 Gateway by Immigrant Services Calgary. Gateway is an innovative client-centric approach to delivering services to newcomers by the way of providing a standardized needs assessment, followed by a referral process to help clients access appropriate services as needed. This program will remove the inefficiency and duplication that comes with multiple agencies collecting data on a single newcomer or newcomer family who may engage with multiple agencies. It will also help identify key barriers and service gaps, enabling the sector to better meet newcomer needs. The Gateway Partner Advisory Council is made up of the following: Center for Newcomers, Calgary Local Immigration Partnership, the Immigration Education Society, the C. de Rocher, the University of Calgary, and Immigrant Services Calgary. Congratulations, and over to you to have a few words. I believe it's probably Hyder speaking today. Do we have someone from Gateway to say a few words? From Immigrant Services Calgary?
Yes, I'm here, team.
There he is.
And this is I'm just shocked, in a state of shock. Thank you so much to the team. And I would like to say this award actually goes out to all the 50+ partners and agencies that are part of it, my board, that have been bold to pursue this transformation. To United Way, thank you for endorsing a Gateway in the early days. To all the politicians, policymakers, and finally, my team who are courageous to challenge the status quo and keep on and living our values of complete versus compete. In the end, I would like to say that Gateway actually does not belong to Immigrant Services Calgary. We are transferring the solution back to the community. Gateway belongs to Calgary. And that's something we'll continue to be focused on. And it is a big honor. And I am in a state of shock right now. And thank you so much. Humbled by this recognition. Thank you so much to the team.
Congratulations to the whole Gateway team. And I really love your words, Haider, about sharing this back with the community. When you first started sharing this solution with me, when you first started in your new role, we were really excited about how it could be a game changer and helping people tell their story once. So congratulations on being able to see this initiative through, and to all the people involved to make it a success story for those people that we're trying to help in the community. Next, I'm going to pass it over to Elder Reg Crowshoe for the presentation of the George Blondeau Indigenous Support and Builder Award. Over to you, Reg.
Okay, good morning. Thank you, Karen. Good morning. I just want to say, first of all, I'm honored to present the George Blondeau Award. Through my personal friendship and relationship that I built with George, I'm honored to present this award. He demonstrated all these attributes when he was working with the different organizations. He brought together cultural awareness. He brought together organizations. He influenced policy. He consulted with Indigenous people and included elders, which where my relationship with George happened, when he included elders in talking to organizations. So I'm greatly honored to present this award this morning, George Blondeau, my friend. The George Blondeau Indigenous Support and Awareness Builder Award recognizes agencies and initiatives which exemplify a commitment to support the Indigenous community and build awareness to both the Indigenous and non-Indigenous communities through services. Eligible candidates demonstrate an internal policy or intentional actions to actively include Indigenous people, implement inclusion and consultation practices of Indigenous people in service design, cultural practices and governance, and include knowledge and awareness of intergenerational trauma, healing, and recognition. This year's recipient, I'm honored to announce Trellis as a community with their community initiative awards. I just want to, from the support from I'd just like to mention that the support from the wisdom of the elders, of the knowledge keepers, Trellis has been able to work to demonstrate working with Indigenous people and to dismantle colonial underpinnings, looking forward to improving the experience of those using the services. I'd just like to, at this time, acknowledge Trellis. I guess I'll turn it over to Jeff. Good to see you this morning.
Good to see you, Reg and Roj, and thank you so much. Oki, Tansy, and hello. It is an honor to receive the George Blondeau Award on behalf of our team at Trellis. We're grateful to be acknowledged for our commitment to reconciliation and to embedding Indigenous ways of knowing and being through all that we do. It'd be easy to say that an award like this comes to us because of good strategy, when in fact, this honor comes to us because of leaders like Christy Morgan and Charlotte Yellowhorn McLeod, who guide this work from the lonely mountaintops and invite us to walk upwards to join them. Charlotte and Christy, thank you for guiding us in this important work. Hand to heart, miigwech.
Okay, congratulations. And I just want to pass it back to Karen. Thank you.
Thank you, Reg and Rose, for doing the award, and congratulations, Jeff. I'm so excited for you. I know how hard and committed you are in this Indigenous journey of reconciliation. So congratulations to you and the whole Trellis team. Well, let's get on to the next award. The next award is the Engaging Communities Award. And you know, the community we live in impacts the kind of chances that we have in life. Research shows that living in neighborhoods with high levels of poverty can negatively impact life expectancy, physical and mental health, early childhood development, and overall quality of life. This award recognizes agencies and initiatives that exemplify a strong commitment to mobilize community members in addressing the issues that matter to them. Agencies or initiatives nominated in this category may have demonstrated the following: leadership, demonstrated the ability to move forward with programs that strengthen communities. Dedication, has shown a high level of commitment to the community and community members. Engagement, has actively worked with community members to mobilize change. Design, has reoriented their programs and services to include and involve community members in all aspects of design, delivery, and evaluation. And of course, impact, demonstrate impact on the improvement and thriving of communities. I want to recognize all of the nominees in this category. They include the 10 Days to Virtual Learning by Bow Valley College and a collective application from frontline shelter providers, including the Drop-In Center, Mustard Seed, Salvation Army, and Alpha House. The 2020 recipient is the collective application from the Drop-In Center, Mustard Seed, Salvation Army, and the Alpha House. Congratulations. This collaborative worked together to create process and ensure no one was turned away in their time of greatest need. Working together, they lent support to each other and created a smooth referral pathway system when needed. And right now they continue to communicate and collaborate ongoing. Their joint advocacy resulted in the homeless population being prioritized for phase 2C of the vaccine rollout. Congratulations on this incredible collaboration. And I can see that my friend Sandra is here to accept the award.
Thank you, Karen, and thank you to the Bhayana Family Foundation and United Way for your recognition and acknowledgement of all of the contributions that community-based agencies and their staff do for our community. I'm just so happy that the recognition of the strong leadership of the 4 agencies here that serve adults in the homeless serving sector has been recognized. I think, through the pandemic, we've had to adapt and adjust just as everyone has, but through our collective efforts and strong collaborative leadership, we've been able to ensure that anybody that needed shelter had access to shelter despite all of the restrictions imposed on our operation. So on behalf of all of the groups mentioned here, thank you so much and really, really appreciate it.
Thank you so much, Sandra, for you and the group's leadership to really work together and leverage and coordinate services together. This really is making a difference for those who need us the most, and it's having a credible impact on people's lives, which, as Rashka said earlier, that's our mission. That's what gets us up in the morning, is that passion for serving others and to make sure we leave no one behind. So congratulations on this great collaborative, and keep up the fabulous work.
Thank you so much.
All right, ready to move on to the Together We Can Award. And this award recognizes significant partnerships between and among agencies, community groups, government, business, and our citizens to address and alleviate complex social problems that can't be solved by one sector or organization alone in order to achieve large-scale, lasting social change. The eligible candidates have identified a community issue and partnered with others to address it through service delivery, influencing systems and policy change, developing collaborative approaches that strengthen the network and capacity of nonprofits and or citizens, achieving outcomes that would not be possible alone. Our nominees in this category are absolutely incredible, and I wish that we could have given everyone an award. But to give you the list, we've got the Center for Newcomers, Immigrant Services Calgary, the Immigrant Education Society, Action Dignity, the Calgary Local Immigration Partnership called the Calgary East Zone Newcomers Collaborative, the Cerebral Palsy Association of Alberta, COVID Re-Entry Strategy for Persons with Disabilities, the Immigrant Services Calgary, Settlement Sector Transformation, Homefront, the Safety of Indigenous Women, the ALEX and the DI, Assisted Self-Isolation of Homeless Individuals, Bow Valley College, the Virtual Innovation Rodeo. Again, all of the nominees are absolutely outstanding, and congratulations to you all. The recipients this year is a tie. It's a tie between the Calgary East Zone Newcomers Collaborative and the COVID Re-Entry Strategy for Persons with Disabilities. Congratulations. The Calgary East Zone Newcomers Collaborative, led by Center of Newcomers, Immigrant Services Calgary, Immigrant Education Society, Action Dignity, and the Calgary Local Immigration Partnership, came together in an amazing response to the pandemic to specifically help newcomers and ethnocultural communities with COVID-19 needs. Through cultural brokers, support was provided in 20+ languages with referrals to more than 16 agencies. It is an absolutely incredible example of how we can work together to help people, and believe that a strong community is created through building relationships. And I absolutely couldn't agree more. Congratulations to the collaborative, and now I'll turn it over for you to say a few words.
Thank you for that again. Very humbled. I would like to call on our chair for the collaborative, Anila Lee Yuen, and the rest of the team. Anila, I don't know if you're, I think you're on the call, but if somebody can put you in the panelists, why don't you say a few words about the collaborative and the leadership that you provided to help us adapt and create remarkable results. If you're not available, then I can speak on your behalf.
Is Anila in the house?
I am. Thank you so much. This is such a surprise. I am not starting my video though, because this has been that much of a surprise. And I'm about to, at 9 o'clock, I start my HIT class. So you do not want to see this hot mess. But but thank you so much. We are so excited to be able to work with the community, work with so many wonderful collaborators. And, you know, we've been able to serve thousands and thousands of Calgarians and do that together, not only with the 16 organizations that we originally started with, but we have over 100 organizations and grassroots community groups that have been working with us, that have been offering
services to the community. And we just hope that we can continue to do this even after the pandemic and help everybody in need and work together. We're stronger together, and it's just so exciting to receive this award. So thank you so much.
Congratulations, Anila, Hyder, and to the whole team. I'm so excited about the work you're doing, and working in neighborhoods, supporting residents that need our support has been a passion of mine for most of my career. And I'm really excited about the silver linings and what we're going to learn about how we can do business differently and support our communities going forward. So again, such a fantastic initiative. Moving on to the COVID-19 reentry strategies for persons with disabilities led by the Cerebral Palsy Association in Alberta, they sought to bridge gaps in COVID-19 guidelines that impacted the lives of people with disabilities. COVID-19 created additional barriers in day-to-day lives, along with the pre-existing barriers they already live with, from not being able to wear a mask, to the challenge of social distancing when assistance from a caregiver is required. The strategy established a task force that brought stakeholders, agencies, self-advocates, academics, and the government together to address the challenges for the disability community. Through their work, an indispensable guide has been created to support people with disabilities, their families, caregivers, and service providers throughout the past year. It's just an amazing work by this wonderful group of people. Turning it over to Cerebral Palsy Alberta to say a few words.
Thanks so much, everybody. We couldn't do what we do without the community, and this initiative just proves that. It happened because of a wonderful group of organizations that got together to really put their first foot forward. I think the person that really should be speaking is Mon Evans, who has led this, and I think you're on this video chat this morning. So this is to you and your team. Great job.
Thank you, Joanne, and congratulations to the whole team. Just incredible support provided to a vulnerable community that needs our support now more than ever. So well deserved. Well, I'd like to thank all of the incredible agencies honored here today and the many others across our community doing incredible work. I know when the tough happens, we all get going. And what I'm seeing every day is the ability to collaborate and partner to achieve even greater outcomes together. And that is something that the not-for-profit sector is good at. And I'm so proud to be part of it. Now I'd like to turn it over to Susan Brooke for the presentation of the Bhayana Awards.
Thank you so much, Karen, and congratulations to all the agency winners of this morning. All the nominations were so incredible, and we're just so honored to be working so closely with our agency partners in the community. So I'd like to move on to the Bhayana Awards. The Bhayana Awards are cash awards of $1,000 each that recognize and celebrate the dedication of our frontline workers. 2 winners have been chosen for each category, with the exception of the Above and Beyond Dedication in Response to the COVID-19 Pandemic Award. Now that's a mouthful, which will be presented to 1 recipient. Now I get the honor to present the first award, the Partnership, Collaboration, and Connection Award. The Partnership, Collaboration, and Connection Award recognizes and rewards individual employees and/or teams who have demonstrated exemplary partnership, collaboration, and/or connection in their frontline work. Over the past year, the nominees have accomplished or demonstrated at least one of the following: dedication to working with other communities, organizations, and/or staff to provide holistic, coordinated service that benefits Calgarians, implementing creative and innovative approaches to partnership, collaboration, and/or connection, working with others to promote, implement, and adjust solutions to changing situations, and fostering cross-organizational and/or cross-sectoral teamwork that benefits Calgarians. Nominees in this category for both their work throughout the pandemic and in their general work include Aboriginal Friendship Centers Calgary's Urban Indigenous Immunization Team, Brielle Batty-Smith, Member Engagement Coordinator at Suggest, Families Matter Frontrunners Team, Homefront Case Management Team, Kevin Fulton, GHP Specialist at CUPS Calgary, Stephen Carlson, Community Developer at CUPS Calgary, and the Trellis Family Resource Network Team. Our two recipients in this category are, and many congratulations go out to, Homefront for the COVID-19 Award and Families Matter. So we'll start off with the Homefront Case Management Team. The case management team at Homefront demonstrates partnership, collaboration, and connection each day, partnering with police, the justice system, and various community partners to provide support to families impacted by domestic violence after they have been in contact with the police and the cases entering the justice system. Through their highly collaborative work, Homefront creates effective, meaningful, and lasting change for individuals dealing with domestic violence. And as we know throughout COVID, they have had to, as most of us, have had to work very differently to be able to support individuals impacted by domestic violence during COVID. I'd like to call on Zainab Rahman from Homefront to accept the award.
Thank you, Susan. We're overwhelmed with gratitude for being selected to receive the Partnerships, Collaboration, and Connections Award. It's a huge honor to accept this award on behalf of Homefront's case management team. Thank you to the United Way and the Bhayana Family Foundation, whose generous donation recognizes organizations and individuals who work to support our communities. As the award title suggests, complex social problems can't solely be addressed by one single agency. Collaboration is central to our success in the intervention and prevention of domestic violence. We're so grateful for our partnerships with the Calgary Police Service, the justice system, and various community partners and agencies in the city that help us provide support to individuals and families impacted by domestic violence. We look forward to continuing with our partnerships to make a difference in our community and are so thankful to receive this award that will help support the work that we do. Thank you very much.
Thanks so much, Zainab. I'd also like to recognize Families Matter and the Frontrunners team. So Families Matter's youth programming team, the Frontrunners, know how children can quickly become vulnerable with the new stresses that COVID-19 lockdowns and social distancing place upon them. To address this challenge, the group turned up their superpower of innovation, finding ways to creatively support children and families through collaboration. Partnering with other local organizations, the Frontrunners developed an initiative to improve health outcomes for children, enabling their participants to socialize, learn new skills, and have fun. I'd like to call on Jordan Dadier from Families Matter, please.
Hi, thank you so much. I'm at a loss for words. I just want to say thank you so much to my team, Denny and Janaea. They are absolute rock stars. We have been able to offer so much more than what I could have imagined. So I'm just so incredibly grateful. I also want to thank Lisa for believing in us, and I can't wait to see what else we can do after this. So thank you again.
Great. Many thanks to both our award winners in this category. I'd now like to ask Howie Shikazi, Rotary Community Hub's Partnership Lead and Community Volunteer, to present the next award.
Thank you, Susan. Well, as a member of an organization, Rotary, that's been building community in Calgary for the last 100 years, it's my privilege to make the Community Building Award presentation today. The Community Building Award recognizes and rewards individuals and or teams who have demonstrated dedication to community building. Over the past year, nominees have accomplished or demonstrated at least one of the following: dedication to asset-based resident approaches, contributing to creative and innovative approaches in community development, demonstrating strong relationship building abilities, empowering others and building capacity, promoting and celebrating diversity, equity, and meaningful inclusion. Nominees in this category for both their work through the pandemic and in their general work include Adanek Sahili, RAVE Project Facilitator, Action Dignity; Bhayana Sutton, Community Developer, CUPS; Sherry Hoshino, Member Engagement Coordinator, Calgary Domestic Violence Collective; the Community Development Team led by Erin Anderson at Trellis. And our two recipients in this category are Adanek Sahili with Action Dignity for the COVID Focus Award, and the Community Development Team led by Erin Anderson at Trellis. Congratulations to both of you. The Community Development Team at Trellis, led by Erin Anderson, works in vulnerable communities across our city to empower residents. Where community resources do not yet exist, the Community Development Team works with resident groups and community organizations to create these supports. The team's combination of meeting resident needs, ensuring resident voices are heard and honored, and focusing on morale and celebration during these trying times has had a measured impact on the communities they serve. And a little bit about Adanek Sahili, a selfless, dedicated community worker, activist, and mother of two. Adanek implemented the Response, Advocate, and Volunteer Engagement, or RAVE project, which supports 23 grassroots organizations. The RAVE program is an emergency response program that addresses the impact of COVID-19 on ethno-cultural communities. With a compassionate heart for those who are struggling to make ends meet, Addie can often be found organizing fundraising initiatives, coordinating volunteers, and driving around the city to deliver goods to those in need. She spends hours on the phone connecting single moms, dads, and new immigrants who are struggling to make ends meet. She connects them all to government and charity organizations. Now I'd like to turn it over to Adanek to accept this award.
Thank you so much. Thank you so much for as a recognition. Adanek Sahili. I am a RAVE project facilitator with Action Dignity. First and most, I would like to thank Action Dignity for helping marginalized ethnic minorities, refugee claimants, single moms, seniors in a dignified way. RAVE stands for Response, Advocate, Volunteer, and Engagement. RAVE supported 21 ethnocultural communities, 40% Black-led organizations supported under this project. More than 600 volunteers and 20,562 hours are recorded under RAVE project. On an individual level, we reached 7,187 disadvantaged people all over the city who cannot have their needs met by other services. We provided culturally appropriate groceries, medicines, diapers for single moms, and information in their first language for ethnic minority communities. Overall, we helped people heal dignity and respect. Thank you, United Way, for this amazing support. Without your support, we can't support these ethnic minorities. Thank you again, Action, Dignity, and United Way.
Congratulations again, Adnek, and congratulations to Team Trellis. And now I'd like to ask Daisy Giroux, Strategy Lead with United Way, to present the next award.
Thank you, Howie. Oki, Tansei, bonjour. Good morning, everyone. Thank you to our elder, Reg Croshoe, for starting us off in a good way this morning with the smudge and words to the creator. I'm humbled to present the Commitment to Person-Centered Practice Award. The Commitment to Person-Centered Practice Award recognizes and rewards individual employees and/or teams who have demonstrated commitment to placing people at the heart of their work. Over the past year, nominees have demonstrated at least one of the following: achieving impactful results with individuals and families served, advancing improvements in client journey, leading an innovative client-centered approaches, and advancing improvements in client continuum of care. Nominees in this category for both their work and thoughtful and throughout the pandemic and in their general work include Alvin Camano, Supervisor for Day Crew at the DI, Kathy Keogh, Director of Counseling Initiatives, Calgary Counseling Center, Conrad Cook, Support Worker at Oxford House, and Melissa Morrison, Site Supervisor for Avenue 15 at Trellis. Our two recipients in this category are Melissa Morrison, Trellis for the COVID Focused Award, and Kathy Keogh, Calgary Counseling Center. Melissa Morrison wears many hats at Trellis. She is currently the Site Supervisor at Avenue 15 and truly went above and beyond during the COVID-19 pandemic. Despite the risk of her own health, Melissa continued her outstanding work reconnecting youth and their families, housing vulnerable youth, and supporting the staff team at Avenue 15. Her selfless efforts to support some of our most vulnerable citizens through a global pandemic were inspiring and deserve celebration. Melissa, I would invite you to offer any words at this time.
Hi, this is so exciting. I'm so thankful for my leadership team at Trellis. They give me so much encouragement and make room for all my crazy ideas. I'm also so grateful to have the privilege of working with the youth that I do. These youth have taught me so much and they're so resilient. My wish is that all programs will see the youth for their potential, not just their past and their behaviors. Thank you.
Thank you so much, Melissa, and congratulations. Kathy Keogh, Director of Counseling Initiatives at Calgary Counseling Center, has put people at the heart of her work, adapting the way she leads her team of staff and serving clients to meet their unique needs. Her commitment to person-centered care has been even more evident this past year while facing the challenges of the COVID-19 pandemic. With Kathy's leadership and guidance, Calgary Counseling Center transitioned from in-person services to virtual counseling within 36 hours of the initial COVID-19 lockdown in Calgary. Although 2020 brought new challenges, Kathy's leadership and dedication to individuals and families in need was unwavering. I believe that Kathy is not on the call, but I would like to wish Kathy a congratulations, and I'd also like to again congratulate Melissa. I'd now like to ask Julia Holby, Manager, Corporate Partnerships and Engagement for United Way of Calgary and Area, to present the next award.
Thank you, Daisy. And again, congratulations, Kathy and the Calgary Counseling Center and all the agencies that have received their awards so far. So the Frontline Innovative Leadership Award recognizes and rewards individual employees and/or teams who demonstrate exemplary leadership in the frontline work. These leaders play an exceptional role in helping others contribute to their organization and advance its mission. These leaders may have introduced ideas, services, or practices in new and imaginative ways, contributed innovative solutions to their organization, or made major improvements to agency operations or services provided. Over the past year, nominees have accomplished at least one of the following: demonstrated leadership in professional development and learning, introducing ideas that increase revenue, reduce costs, or improve services, enhancing efficiency accuracy, or productivity in innovative ways, introducing changes to simplify or improve existing processes, challenging existing assumptions and thinking outside the box, taking calculated risks in pursuit of continuous improvement. So nominees in this category for both their work throughout the pandemic and in their general work include Amy Monroe, Team Lead, Direct Service, SAGES; Judith Kovacs and Team, Language Assessment and Referral Center, Immigrant Services, Calgary; Lisa McKay, Natural Support Worker and Circle Keeper at Trellis. Our two recipients in this category are Judith Kovacs and Team, Language Assessment and Referral Center, Immigrant Services, Calgary, for their frontline innovative leadership in response to the COVID-19 pandemic, as well as Amy Monroe, Team Lead, Direct Service, SAGES. So about Judith Kovac and the Language Assessment Team. The Language Assessment and Referral Center at Immigrant Services Calgary provides English tests for immigrants who would like to study in federally and provincially funded language programs or enroll in professionally related courses in Calgary and Southern Alberta. Prior to the pandemic, the Canadian Language Benchmark Placement test was held in person and online for those who lived in remote communities and were not able to go to the office. To be able to take the test online, the clients had to go to a testing site where a proctor helps them with all the aspects of the assessment. After the closure of schools and their office in March 2020, both in-person and remote ways of testing became impossible to offer. In partnership with the Centre of Canadian Language Benchmarks, Judy Kovacs, Sally Okasha, Lindsay Nill, Nargiza Jaliova, David Whitehead, led the development of a new proctorless version of the existing remote assessment. By the end of April, this small but mighty team found a new platform for the listening speaking test, developed a procedure to screen clients, and found ways to communicate with clients before, during, and after the test. After many pilot tests, the Centre for Canadian Language Benchmarks evaluated the findings, built the new documentation and procedures, and ultimately gave permission to start using the newly formed tool. The Immigrant Services Calgary team was the first in Canada to use the new tool and are proud of their leadership in developing the new tool. As of March 17th, 2021, over 2,500 people have completed the test from the comfort of their homes. Over to you, Judith, to say a few words. Congratulations.
Thank you very much. I'm super excited and thank you very much for this award. It's a great privilege and honor for our team that we were recognized for our efforts. And I would like to highlight that it was a team effort. I'm just one of the team, and I'd like to say thank you for my team members. And also I would like to say thank you for the management, Bhayana Tratnik, then our managers, and now our present management, Hani Ibrahim and Jillian McDonald, for their continuous support. Thank you very much.
Congratulations again, Immigrant Services Calgary. Thank you so much, Judith. So about Amy Monroe with SAGES. Under Amy's leadership, the direct service team was able to alter the in-person programming, facilitation plans, workbooks, and clinical programming features into a new format that would work on Zoom. They made the changes within the team and quickly and comprehensively communicated the changes to their volunteers and participants. Amy worked closely with SAGES's executive team to manage the development of new privacy protocols to handle any issues that may come up, while participants were talking about very personal experiences of abuse online. Amy also worked on the development of a new text and chat support feature that allowed people within Calgary and across Alberta to access support and resources from SAGES from the privacy of their web browser or phone. Since many people in Calgary were isolated with their abuser, these types of access points became increasingly required. In addition to these items, Amy also worked on developing a new program to help support informal supporters. This program, called Stand By, recognizes that supporting someone experiencing or using abuse can be emotionally and mentally exhausting. This peer-based group provides both informal and formal supporters an opportunity to talk to a SAGES facilitator, as well as other supporters about their experience, ask questions, and provide encouragement. So congratulations to the team at SAGES. Do we have Amy on the call to say a few words?
Amy unfortunately actually had to step out of the call. And so I'm Carrie McManus, I'm the Director of Innovation here at SAGES, and I just wanted to pop on very quickly. Amy actually is doing some amazing frontline innovation leadership work right now and supporting her team with another new initiative of some frontline support in another new project that our direct service team has taken on. And so I wanted to just pop on and say thank you so much to the United Way for this recognition of Amy. She has been an incredible force within this organization for many, many years. And over the past year for COVID, she has really led our direct service team through an incredibly difficult year and has really been such an incredible support for our clients, our volunteers, and our staff, and it's a very well-deserved award for her. She's texting me right now saying she cannot believe it. So thank you so much for the recognition. It's really quite amazing.
Wonderful, congratulations again. We pass that along to Amy and the whole team at SAGES. So I'd now like to invite Jean Parker from United Way's GAIN team to the screen to announce the final award recipient this morning.
I am so honored to present the Above and Beyond dedication in response to the COVID-19 Pandemic Award. The Above and Beyond Dedication Award recognizes and rewards individual employees and/or teams who have demonstrated remarkable commitment and passion to their work and community through the COVID-19 pandemic. Over the past year, the nominees have accomplished or demonstrated at least one of the following: inspired those around them, work to build resilience in their organization and our community, introducing and managing change in a transformational way, and serving as mentors, valued advisors, or sources of wisdom for others. So the nominees in this category include Fatima Makavinta, she's nursing coordinator, licensed practical nurse at the Drop-In Center. Melania Mocha, adult care worker, DI. Full staff team, Calgary Counseling Center. And lastly, Jocelyn Dubois, volunteer coordinator at SAGES. The award recipient in this category is Fatima Makavinta, nursing coordinator, licensing practical nurse, the Drop-In Center. Fatima worked as a case manager for the housing team for many years prior to the pandemic. However, once the pandemic hit, she pivoted her position and joined the healthcare services team, where her education and knowledge in healthcare could be utilized. Fatima was instrumental in the design and setup of the Overflow Shelter Health Services delivery model. She has worked tirelessly to ensure there is early intervention and isolation options as positive COVID-19 cases hit the DI. On top of her critical role during the pandemic, Fatima's leadership skills never faltered. She was quick to provide support and advice to new healthcare workers and on how to stay safe in uncertain times and how to keep others safe, and she led fearlessly. So Fatima, would love to hear from you. Fatima, are you out there?
Hi.
Oh, congratulations.
Sorry. Thank you. Thank you, Bhayana Foundation United Way. It is overwhelming. It is great honor to receive this award. Thank you to the DI family, to all the staff, to all that you do. Thank you for spreading kindness to find this pandemic and end homelessness. To the leadership team, Kyle, Daniel, Natalie, Sandra, I will always be grateful. To the Alex, the ACES family, you guys are doing such a great job. To the health services team, Thank you for your resiliency and hard work. This recognition is for each of you. And to everyone here in this event, thank you, and stay well, stay kind, and get your shots.
Thank you, Fatima. Way to go. Congratulations, Fatima, and to all the recipients today. Your stories and work is inspirational, and we all appreciate your work to keep our community healthy and safe. Wakefield, back to you.
Thank you so very much. I would like to say thank you. And before we move any further, I would like to introduce Kathy and Pat to come on back onto our presence, please.
Hi there. I'm one of the community development workers for Trellis, and we received the Community Building Program award. So thank you very much. My connection looks like it's bad, so I'm not sure if you're actually able to hear me. So thank you for the award. We're very grateful for it. We're also very grateful for the partners in the community that we've worked with, and for people who opened their doors when they could only see this much of our faces when we were going around door knocking and asking what their needs were, handing out resources to them. And we are especially thankful for the volunteers, the resident leaders who commit time, juggling their family, making suggestions for how we can do things to meet the needs in the community, helping us with handing out activity kits and food in the area. They're so kind and generous with their time. We also want to thank Trellis. That's the agency, a combination now of Boys and Girls Club and of Legacy Aspen, that they support us in our work in the community and have amazing leadership for us. We also really thank United Way for their support financially and their belief in grassroots productions and work in the community. Thanks.
Thank you so very much, Pat. I'd like to say this has been an incredible group of finalists and recipients, and I'd like to extend my sincerest congratulations to each and every one of you. At this time, before we turn the virtual microphone over, we'd like to ask all of the award recipients and presenters to turn your cameras on so that we can have ourselves a group photo. If we were all together, we would all be piling up on a stage, but we have left the classroom, we're into the class Zoom, and we'd like you to all open up your virtual hearts, turn on your cameras, and prepare for a group photo, please. All right, big smiles. 3, 2, 1, congratulations. I hope we captured that. I hope we got what we need, because now I'd like to move on. I have the distinct honor of introducing our next speaker, Minister Rajan Sani.
Good morning, everyone. It is such an honor to be here today to help celebrate the outstanding achievements of outstanding organizations. And I have to be honest, I was a little bit misty-eyed as this presentation unfolded this morning, because it just brought back so many memories of conversations that I've had with many of you over this past year. It's been both uplifting and cathartic to hear the stories about the work you're doing, the people you're helping to heal and strengthen our communities. We need to tell more stories, as Raksha Ji from the Bhayana Foundation said in her opening remarks, and she may have been paraphrasing you, Wakefield. It's the stories, the poetry and the metaphors that really stir the hearts and minds, and how will anyone know unless we share these stories? This has to be an intentional exercise, and I encourage you to do more to continue to share your experiences with openness and vulnerability. Albertans everywhere need to know if they don't know already. Many congratulations to all award winners, frontrunners, and finalists alike. Your dedication and commitment is moving. I can hear this dedication in your voices when we speak. I heard this commitment in your voices when we spoke in the early days of the pandemic, when we weren't sure about what the landscape was going to look like. It was a bit scary. I've also come to know many of you, and I'm honored to work more directly with some of you in my role as co-chair and provincial representative on the Calgary COVID table with the Calgary ESO Newcomers Collaborative. I can say that I've seen all of you tackle some of the most challenging issues in our society: poverty, addiction, domestic violence, mental health, and homelessness. And all of this in the midst of this horrific pandemic. It has made all of our jobs exceedingly difficult and challenging as we navigate through the changing face of this pandemic. And there's also no doubt that many of you have taken on additional risks and challenges to continue to do your work, and I do want to recognize that. A mere thank you is an understatement, but much gratitude to all of you for your continued commitment, sacrifice, and creativity in making sure people have access to the resources and services they need. When I envision a post-pandemic Alberta, I will continue to work with all of you to build stronger communities. And this commitment will extend beyond my political life. I can tell you that as MLA for Calgary Northeast, one of the hardest hit areas in the country, perhaps even the continent, that many underlying systemic issues were brought to the surface, and they will take time, patience, and sustained effort to address and resolve. This pandemic has not impacted everyone equally. Dr. Verna Yu alluded to this in her remarks when she spoke about barriers and the need to address these barriers as we move forward and to ensure that we capture and apply all of our learnings. We can't afford to move backwards. Vulnerable Albertans can't afford to move backwards. We know that this pandemic has hit certain Albertans and Canadians disproportionately, particularly frontline essential workers, particularly newcomers, particularly those living below the poverty line or do not have a place to call home, particularly disabled Albertans, particularly women from racialized communities. And within these impacts, there is intersectionality. We know this, and this compounds the impact on vulnerable Albertans even more. Again, this highlights even more the need to tell these stories. I implore you to tell your stories because Albertans need to know. On this latter note, on the impacts of the pandemic on women, I have a lot to say about this, and you'll be hearing more from me about this. But for now, I will simply say, when I envision a stronger Alberta, I know that we must inculcate and enhance strength in the 51, intentionally and visibly, because strong women lead to strong communities. And finally, thank you to the United Way for all that you do and that you will continue to do. Thank you, everyone, and congratulations once again.
Thank you so much, Minister Sani, for your words of inspiration today and for being such a great model through all of COVID-19. I know you've been in the front line, you've been in the trenches with everyone, and it's all about what Dr. Verna Yu said about building trust. And that's really what we've all been doing together, isn't it? We're learning about each other, we're building trust, we're living by our values, and together we can really make an impact and change our community for the better. As we look together at some of our marginalized populations and what some of those opportunities are, whether it's women and the impacts of COVID on women and families, whether it's people with disabilities, whether it's people who don't have a home, we really are all in this together as a sector. And through multi-sector partnerships, collaboration, innovation, shifting the way that we think about things, I feel like you that we can get through to recovery and resiliency in a good way. So thank you again for your leadership and commitment to all Albertans and to the not-for-profit sector through these challenging times. It's just an honor. Thank you, Dr. Yu, for your thoughtful speech and for your leadership in our province to make sure that Albertans are receiving the needed healthcare and well-being right now. Your words were very inspirational, and you also know what it's like to be on the front line, but in a challenging leadership position, you're also looking for those opportunities to collaborate and partner and to be innovative during this time of digital disruption and the pandemic. And to the Bhayana Family Foundation, thank you, Raksha, for your passion for our sector, your continued support. We are so grateful for all that you've done, not only in Alberta and in Calgary, but across the country. Your role modeling and your leadership is truly making a difference. And thanks to all of you for being here online with us today. All of the agencies, all the agency leaders, all of the frontline workers. I really hope it was a good start to your day to take a moment, reflect, and recognize all the incredible accomplishments we have made together. I know normally we'd be able to celebrate in person, but being here online has been a wonderful way to celebrate your hard work and acknowledge what you've accomplished. Thanks to all of you. I feel a great deal of hope from being together with you this morning for what's to come. Let's keep looking for those silver linings. Now, to close the event, let me reintroduce you to our Master of Ceremonies, Wakefield Brewster, for a closing performance of his poem, I Can.
Good morning, and thank you so much, Karen, for this reintroduction. I'd like to say it's been an honor to be part of these ceremonies today. I am really going to give you my best as a human being, and that's as a poet. No matter what it is, regular, everyday problems to pandemics, poets, artists, we respond artistically. And that's what I'm going to do with you today. This poem, I Can, is a fairly landmark poem because it is a poem of self-empowerment. And of course, we have all seen that through the pandemic times, which we are still living through, lots of people simply feel powerless, and therefore why we are just languishing. I would like to remind everyone that when it comes down to doing what you really want to, what you need to, being the person you really need to, really have to, there is a lot of pushback in the world. There is a lot of you can't, especially during this time where we feel chained and powerless. There is a lot of I can't. This poem will give you an idea of my growing up with being a child alcoholic and having mental wellness problems and triumphing through the trials and tribulations of school, culture, and the like. However, the greatest thing I want everyone to take away from this poem is when you come up against I can't, when you come up against you can't, please remember two things. You probably can, and you probably should. This poem is called I Can. After a decade of delivery on the MIC, unbelievably, people still asking me, what can you do with poetry? That question used to make me angry. It used to get me hot. Now I tell them have a seat and ask them how much time they got. For you see, with poetry, I can duly dance down those same halls of learning where I once had the yearning to be a well-accomplished human with a 4.0, but my GPA was sadly way far below. I never got the knack of the educational flow. They made me sit still, so I stood still. I can confidently, comfortably cruise into classrooms where I was once coerced to create a captured, cornered mental state so I could clearly create a way to hate my own mind. By my educators, they were educators. They formed a form to form my formative years, tainted with intolerance and a tidal wave of tears that sailed all of my dreams away from me. For they likened my self-image with one of stupidity. It was all that I heard and all that I could see. I can now be free, where I was once imprisoned by a mental prism. My errant splayed thoughts were like hot-colored rocks, endless ammunition for the slings of possibility, but impossibly, all of my targets eluded me, for I was living in the kingdom of couldn't be me. I couldn't see the lock, so I didn't need the key. And when they finally let me go, they said, you don't know poetry. I can versify being victimized into a valiant victory. Verify that when you vilify, you eventually gotta deal with me. The transformation was tremendous. I took the word stupid and I made it stupendous. I began to manhandle the land of language that languished in apathetic and anonymous anguish. I did decide to dissect and divide indefinitely, indubitably, what diction was doing to me. Stab a psyche with a simile, sometimes slip left of center, see, so as to step off into a soliloquy, ail the English alphabet with an oral atrocity. I can wear the face of mental agility, dispel the myth of dental fragility, and proudly embrace my so-called disability. ADD, ADHD, OCD, PTSD. Now I've made an acronymphomaniac out of me, and never once before have I so ever loved ME. I can turn my inventive imagination into a physical infatuation, not like sugar, not the hard refined, not like sweetener, not the artificial kind. I don't need heroin because I'm a hero in my own mind. Spent some time with my mentality, and what I did find is I can learn. And poetry taught me when the truth is unfurled, I'm the only one man who can change my world, so I can do anything. What can I do with poetry? I ask you, why don't you tell me? I would like to thank you all, every single one of the recipients, award winners, every single speaker, presenter, participant, everyone behind the scenes that put all of this wonderful collaborative effort together, and especially each and every single one of you. Thank you very much. My name is Wakefield Brewster, the Lyrical Pitbull. Have a great morning. Stay safe.
Have a good day, everyone. Thank you so much. And that was just incredible, Wakefield. Thank you for inspiring us for the rest of the day.
Thank you so very much for having me. Thank you, one and all. Thank you, everyone who put this together. Thanks for asking a poet to be a part of it. Thank you. And by the way, I'm going to look every single one of you people up and friend you on social media. You're important.
You're fabulous, people. Wakefield.
You're important people. I should know you. Thank you so much.
I'm so glad we got to meet on the Hope Conference.
Me too. It's a bit of a stretch. It's a bit of a stretch, but I'm trying to show the world you can write away to wellness. So one letter at a time.